Bismillahirrahmanirrahim. Rabbi shrah li sadri wa yassir li amri wahlul uqdatam min lisani yafqahu qawli. I am Dr. Mudassir Shabazz, Associate Professor, Sahara Medical College, Narowal, and today we are going to discuss about the mediastinum. As you can see that it consists of two words, media and stinum. In the Latin word, it is means middle septum, but here we can understand that it's a space in the median plane between the two lungs behind the sternum. So mediastinum can be defined as it's a partition between the right and left pleural sacs. Within the thoracic cavity, there are two pleural sacs, right and left, which are surrounding the lungs. Between the two lungs, between the two pleural sacs, is a partition which is named as mediastinum, and it includes all the structures which lies in that space, in the intermediate compartment of the thoracic cavity. We will see what are the structures which are lying in the mediastinum. But before that, we will have an overview of the mediastinum. It's a Latin word which means middle septum, and it is occupied by the mass tissue between the two pleural cavities or pulmonary cavities. It's a central compartment, and it is covered on each side by the mediastinal pleura. The mediastinal pleura is the pleura which is parietal one. Visceral is covering the lungs, but the part of parietal pleura which is coming on the medial side of the lungs towards the mediastinum is the mediastinal pleura, and it contains all the thoracic viscera and structures except lungs, because lungs are present on each side. The lungs, they are covered by the pulmonary cavities, pleural cavity. The mediastinum, it extends from the superior thoracic aperture to the diaphragm inferiorly. We can very well understand from the diagram. If you have opened the diagram with you, I will show you the diagram in the coming slides. And from the sternum to the costal cartilages anteriorly to the thoracic vertebra posteriorly. So if we place our hand, one left hand over the anteriorly sternum and one on the back over the thoracic vertebra, the part between the two lungs that we are having holding in the center is the mediastinum. But when we see this mediastinum in the embalmed cadaver, that is because it's a dead body and it is embalmed, the mediastinum is not a mobile. But in the living persons, it is a highly mobile region, because it consists primarily of the hollow, liquid or air-filled visceral structures, which are, for example, the visceral structures united by the loose connective tissue, often infiltrated with the fat. And these structures, we can very well imagine, the lungs are moving towards the mediastinum and away from the mediastinum while they are during inflation and deflation. And also the heart is present within the mediastinum, which is continuously contracting. Also other structures are present, esophagus, trachea, and the aorta, which is pulsating all the time. These are all present in the mediastinum, and they are connected with the loose connective tissue, with the fat. And the major structures are in the mediastinum also surrounded by the blood and lymphatic vessels, lymph nodes, nerves, and fats. So if we see here, this is the pleural cavity, which is covering the lung, both lung. The pleura which is covering the lung is the visceral one. The pleura which is covering the chest wall is the parietal one. This parietal pleura, when comes towards the mediastinum, it is named as mediastinal pleura. So this is the space between the two lungs, two pleural cavities. And it's a mobile structure. This structure, within this, they are connected by loose connective tissue and fat. The looseness of the connective tissue and elasticity of the lungs and parietal pleura on each side of the mediastinum enable it to accommodate movement as well as volume and pressure changes in the thoracic cavity. First of all, it will accommodate the movement of the lungs on the mediastinal side, and as a result of that, the changes in volume and pressure changes in the thoracic cavity, it is also accommodated in the mediastinum. You know, when one thing will, the lungs will inflate and deflate, there will be pressure changes within thoracic cavity, within the pleural cavity as well as the thoracic cavity, and these are accommodated by the mediastinum. Because why? Because of loose connective tissue and present in the mediastinum. And for example, resulting from movement of the diaphragm, thoracic wall, and tracheobronchial tree during the respiration, contraction, beating of heart, and pulsation of the great arteries, and passage of ingested substances through the esophagus. These are all accommodated in the mediastinum. The connective tissue becomes more fibrous and rigid with the age. This connective tissue, which is present in the mediastinum, it becomes fibrous and rigid with the age. And consequently, the medial stinal structure will become less mobile. And now we will see that mediastinum is divided how? Into parts. So first of all, there is division of mediastinum. In this diagram, you are seeing an imaginary line passing through the sternal angle, and posteriorly it is passing through the disc between the T4 and T5 vertebra. This is called as the sternal plane. Sternal plane. This is the plane of thoracic aperture, superior thoracic aperture, the upper border of T1 and the manubrium sternal notch, the jugular notch or suprasternal notch of the manubrium sterni. So we see that anteriorly it is bounded by the manubrium, posteriorly it is bounded by T1, T2, T3 and T4 vertebra. This is called as superior mediastinum. Below the line of sternal plane is the inferior mediastinum. The inferior mediastinum is further subdivided into three parts. This is the inferior mediastinum, which is divided into three parts by the pericardial cavity and heart. This is the pericardium and heart. In the pericardial cavity located is the heart. It divides the inferior mediastinum into an anterior part between the pericardial cavity and pericardium and the body of the sternum, anterior mediastinum, the heart itself with the pericardium and pericardial cavity, and also the phrenic nerves, which are very closely related with the fibrous pericardium. This includes the middle mediastinum, and posteriorly between from vertebra thoracic 5th to the thoracic 12th vertebra. Between it and the posterior part of the pericardium is the posterior mediastinum. So inferior mediastinum is further divided into three parts by the pericardium and pericardial cavity and the heart. Now here we see horizontal plane extending from the sternal angle to the lower border of T4. We have seen it. And superior mediastinum above this plane, inferior mediastinum below this plane, further divided into anterior in front of pericardium, middle contains of heart and pericardium, and posterior behind the pericardium. So here again we see this is the sternal plane, which is extending from the sternal angle to the disc between T4 and T5. Above this is the superior mediastinum, below this is the inferior mediastinum, and here is the heart and pericardial cavity. Anteriorly is the anterior mediastinum, posterior to it is the posterior mediastinum, and this is middle mediastinum. So here now we will see the structures in the superior mediastinum. So here again this simple diagram is shown here showing the superior mediastinum. For the students, I will suggest that they should try these simple diagrams for the examination purpose, because these are simple and easy to draw. So if you try it and if you draw it and practice it, it will help you in the examination for the description purposes, that you will explain your answers very efficiently. And obviously anatomy is the diagram. Every structure has the diagram. Now we have seen the superior mediastinum. Now we will see here shown the structures in the superior mediastinum. At this level, the plane of the sternal plane passes. So what structure we will see in the superior mediastinum shown here? We are seeing here arch of aorta. We are seeing azygous vein. We are seeing trachea bifurcating into left and right bronchus, and we are seeing posteriorly esophagus, and we are seeing here the veins have been removed in this diagram, the superior vena cava as well as the right and left brachiocephalic veins. The nerves have been shown here passing from the neck region into the superior mediastinum, the phrenic nerve and the vagus nerve, and one nerve passing from the thorax into the lungs, into the neck region, that is the recurrent laryngeal nerve. Here in this diagram are shown. So this is showing the structures which are present in the superior mediastinum. Here another diagram showing the structures. Trachea, behind it will be the esophagus. We have seen in the previous diagram. Arch of aorta, this plane is the sternal plane, arch of aorta. Here is the vein, great vein, superior vena cava, left brachiocephalic vein, right brachiocephalic vein. These are the branches of the arch of aorta. Along with the nerves will come into this. So contents will include from behind forward esophagus, trachea, then the arch of aorta with the branches, then the right and left brachiocephalic veins and superior vena cava, then the thymus gland, which is not shown here. It will be shown in the next diagram. Here we see again. So if we see in this diagram, this is the trachea, behind it will be posterior, will be esophagus, arch of aorta is shown here, and then is the left brachiocephalic vein, right brachiocephalic vein, superior vena cava, and here is the thymus present in the superior mediastinum. So others contents will be nerves, right and left vagus nerve, right and left phrenic nerve, that will come from the neck into the thorax. Right and left sympathetic trunk most posteriorly will be along the vertebral bodies, will be the right and left sympathetic trunk. Left recurrent laryngeal nerve, as I have shown you in the previous diagram. If you go into the previous diagram, I will go for you into this diagram here. Here is the left recurrent laryngeal nerve, branch of the vagus nerve. Along with that will come the phrenic nerve on each side. Lymphatics will include the thoracic duct as well as the lymph nodes in the spleen. This diagram is very important for the students. It's a transverse section showing inferior view of the transverse section of the superior mediastinum, that is seeing from below. Seeing from below, so if you are seeing from below, this will be the brachiocephalic trunk here, and if you see this one is the left brachiocephalic vein. So this is the left side, this is the right side, because we are seeing from the below. If you evaluate, in my advice, students should try to draw it and try to understand it, and this will help them in understanding the structures in the and relation of the structures in the superior mediastinum. Both sides are the lungs. This is right lung, this is left lung. Mind it, you are seeing from below, inferior view. So anteriorly is the sternum, posteriorly is the vertebral bodies. Anterior to the vertebral body is the esophagus, then anterior is the trachea. Then the branches of the arch of aorta are shown here. That is the brachiocephalic trunk on the right side, left common carotid, left subclavian on the left side. Here is the thoracic duct most posteriorly. On the sides, here will be the sympathetic trunk on the both sides of the vertebra posteriorly. And here are shown the paratracheal lymph nodes. Multiple lymph nodes are shown here. The internal thoracic artery and vein are shown here anteriorly, anterior to the left brachiocephalic vein here, and one will be on the right side. So this diagram explains the structures. It is at the level T3 vertebra. T3 vertebral level is here of the superior mediastinum. Now, first we come to the superior vena cava. The superior vena cava is formed by the union of right brachiocephalic vein and left brachiocephalic vein. It is formed by the union behind the sternoclavicular joint or behind the first sternocostal joint, and it vertically descends downwards, and it ends at the level of third costal cartilage, where it enters into the right atrium. It is located on the right side of the superior mediastinum, anterolateral to the trachea, you can see here, posterolateral to the arch of aorta, you can see here, ascending aorta, posterolateral to the ascending aorta, you can see here, is posterolateral to the ascending aorta, and from the posterior boundary of the transverse pericardial sinus, that we will see when we will study the heart and pericardial cavity, how the transverse pericardial sinus is formed and how it forms a relation there. So here is the superior vena cava, a very short structure which drains blood from the head and neck region and upper limb into the right atrium. Also, along with that, the whole of the blood from above the diaphragm is drained from the thoracic wall and thoracic cavity by the superior vena cava above the diaphragm. The vein will drain into the superior vena cava and then they will enter into the right atrium. Then is the thymus. It's a lymphoid organ located at the inferior part of the neck and interior part of the superior vena. It extends above into the inferior part of the neck and then into the superior mediastinum, and also it extends down into the medial mediastinum a little bit over the fibrous pericardium. It's a flask shape, you can see, and lies posterior to the manubrium, extend into the interior mediastinum over the fibrous pericardium a little bit. And it's after puberty, the thymus undergoes gradual involution and is largely replaced by the fat. So in the adults, when you go for cardiac surgery or you open the chest for other reasons, you will find the thymus involuted. It's not as in the children, because its primary role in the immunity formation is in the childhood, not in the adults. So in the adults, the thymus that goes into gradual involution. It is richly supplied by the arteries derived from the anterior intercostal and anterior mediastinal branches of the internal thoracic artery. Why I'm mentioning here? Because this is all many times asked as an MCQ by the examiners, that the blood supply of the thymus is from the anterior intercostal arteries, so that will be the correct answer, and anterior mediastinal branches of the internal thoracic artery. The veins, they will drain to left brachiocephalic vein, internal thoracic and inferior thyroid vein. Inferior thyroid veins, the vein of the thymus, that also drain into inferior thyroid veins also. So that can come as an MCQ. The lymphatic vessels of the thymus ends in the parasternal and brachiocephalic and tracheobronchial lymph nodes located in this region, thymus. Then is aorta. In the superior mediastinum is ascending arch and descending aorta is located in the superior mediastinum. The ascending beginning at the aortic orifice of the left ventricle, here we can see it will start from here, courses in the middle mediastinum, then continues as the arch of aorta at the level of T4. The arch that starts in the superior mediastinum continues as the ascending aorta, so is not located in the superior mediastinum, it is below in the middle mediastinum. But the arch of aorta starts, because it's a very short part, the arch of aorta is start from the sternal plane in the superior mediastinum and ends at the T4 level, disc between the T4 and T5. Then start the descending aorta, and it continues up to the diaphragm as descending thoracic aorta. So if we see arch of aorta, the curved continuation of the ascending aorta, it begins posterior to the second right sternocostal joint. Right sternocostal joint, second one, start from here, and then at the level of sternal angle, arches superiorly and posteriorly, and to the left, superior, posterior, and to the left, then inferiorly. Arch ascends anterior to the right pulmonary. Here is the pulmonary trunk. Right pulmonary dividing into two branches, right and left. So it's right and left. It's arching over the right one, and the bifurcation of trachea, reaching its apex at the side of trachea and esophagus, and it passes over the root of left lung, not the right one. The arch descends posterior to the left root of lung, beside the T4 vertebra. Arch ends by becoming the thoracic descending aorta, posterior to second left sternocostal joint, starting from the right sternocostal joint, ending at the left sternocostal joint, second one. So here is the arch of aorta. Necessary to mention here also is the arch of azygous vein, because it is very similarly to the arch of aorta, but it's on the right side. A position corresponding to the aorta on the right side of the trachea over the root of the right lung, although the blood is flowing in the opposite direction, because it's draining blood towards the heart. Aorta is taking blood away from the heart. The ligamentum arteriosum, the remnant of the fetal ductus arteriosus, passes from the root of the left pulmonary trunk to the inferior surface of the arch of aorta. The urinary branches of arch are the brachiocephalic trunk, left common carotid, left side liver. Then is the vagus nerve. Is the 10th cranial nerve. The right vagus nerve descends into the right side of the trachea. The right side of the trachea and form the posterior esophageal. Here the esophagus plexus continues in the abdomen as posterior gastric nerve. Left one on the left side, and between the left common carotid and left subclavian, it descends down up to the arch of aorta, and here you can see it is giving left recurrent laryngeal nerve. The right recurrent laryngeal nerve is given at here, where it is crossing the brachiocephalic trunk. Right subclavian artery arching back is the right recurrent laryngeal nerve, but the left recurrent laryngeal nerve is arching back under the arch of aorta. Then is a phrenic nerve. It is having root value of C3, C4, and C5. It enters the two nerves, right and left. The right phrenic root descends on the right side of the spiravena cava and the heart. The left descend on the left side, and both nerves terminate in the diaphragm. They supply the diaphragm, both sensory and motor. We will discuss these nerves in detail later on. Anterior mediastinum. So, anterior mediastinum is anterior to the middle pericardial cavity. It's part of the inferior mediastinum, which is divided into anterior, middle, and posterior mediastinum. So we can see the above is the horizontal plane, superiorly, inferiorly is the diaphragm, and anteriorly is the sternum and xiphoid process, posteriorly is the heart, and lateral side will be the lungs, and pleura will be present. Here comes the thymus, part of the thymus into the anterior mediastinum, and lymph nodes will present here in the anterior mediastinum. So here you see the interior mediastinum. Also, this diagram is very helpful in showing the arch of azygous vein. Now comes the posterior mediastinum. posterior mediastinum, anterior will be the, here will be the pericardium. Posteriorly lower 8 vertebrae. Superior horizontal plane. Inferior is the diaphragm. On each side will be the pleura of the lungs. So it's the boundary of the, that is the posterior mediastinum. The structures, very important structure present in the posterior mediastinum along with the other structure is the thoracic duct. Beginning continuation of cisterna chyli passes through the aortic opening of the diaphragm, ascends in the posterior mediastinum posterior to the esophagus, ascends in the superior mediastinum to the left of esophagus. First it is posterior to esophagus, then it is to the left of esophagus. It receives lymphatic from the all body except right side of the thorax, right upper limb and right side of the head and neck region. That is, right side above the diaphragm will be drained by the right lymphatic, otherwise whole of the lymph from the body is drained by the thoracic duct. It ends in the left brachiocephalic vein. Here are shown the diagram which is showing the course of the thoracic duct, and it is ascending on the right side of the aorta and left to the azygous vein, ascending upward, crossing towards the left side and then entering into the brachiocephalic vein. On the right side will be the right lymphatic duct. This is the, all the structures has been removed. This is the descending thoracic aorta. Another diagram showing the structures in the posterior mediastinum, esophagus, and with the esophageal plexus, and on the both sides are the sympathetic chain is running down, and the vagus nerve which is forming plexus over the esophagus, then entering into the abdomen over the to supply the abdominal organs, that is the stomach, small intestine up to the transverse colon, the vagus nerve. It supplies the abdomen. Here we can see. Another diagram showing the structures in the posterior mediastinum, esophagus and descending thoracic aorta, the main structures which are present in the posterior mediastinum. Another diagram, simple diagram showing the structures in the posterior mediastinum, azygous vein, thoracic duct, that is the descending thoracic aorta, esophagus, and they are and also along with the sympathetic chain has been shown to you. So that is by the showing the, and also branches are from the thoracic aorta to the esophagus, esophageal arteries, and also originating from the aorta are the bronchial arteries. So posterior mediastinum contents will be esophagus, most anterior structure, thoracic duct, right and left vagus, descending thoracic aorta, azygous and hemiazygous vein, right and left sympathetic chain trunks and their branches, branching nerves, and the lymph nodes obviously will be present there. Middle. The middle one will include only the heart and pericardium. Pericardium and the heart ascending aorta and pulmonary trunk, lower half of the superior vena cava, termination of the inferior vena cava and pulmonary veins. Phrenic nerves are included in the medial mediastinum because we will see that they are very much plastered with the pericardium during their course. That's why they are included in the middle mediastinum, and the lymph nodes will be there. Anterior mediastinum, and you can see the body of the sternum, the pericardium, sternal plane above, below is the diaphragm, and lateral is the mediastinum pleura. Loose connective tissue fat and lymphatics will be there. So here is the a table given in the KLM, and this table shows the interior, its limits, its anatomical structures present. Here is the symptoms of its anatomical structure, thoracic inlet, and clinical problems produced by the tumor invasion. Next, we will discuss individually about the veins and arteries of this mediastinum and the thorax in the posterior mediastinum, other visceral structures in the mediastinum.